does this approach then have on continuity of care, on physician engagement, and then service line stability when this is all in the right place?
Absolutely. Great question. Because again, at the heart of everything we do, we're here for the patients, right? That is why we are here every day. And by having a more cohesive approach to utilizing locums, to the retention strategy, as Teague was just talking about, and keeping the folks here, you're able to continue providing care to your community when they need it the most. And that's key, because that's what we have to do. Because if we can't provide it, they're going to go somewhere else, but they may have to drive an hour away. We want to be able, by using all of these tools together, be able to really supply that need and be able to take care of our folks. And from a system perspective, that's what our goal is patient care, clinical quality care. And again, it's the patient access, and essential to make sure not only are your locums, folks set up to be successful day one, but also all your employed folks. So, you bring everybody together and get everyone, let's focus on what's the most important.
Yeah, true integration, truly integrated. Yes. is the key there. And Chris, again, just to come back to the systems comment that you made earlier, right? It's so key. Again, from where you're sitting, when we have this integrated approach, right? When we have this system, what's the impact? What impact have you seen this actually make on, again, physician engagement and service line stability and certainly the patient continuity of care?
Well, I think at the end of the day, we all realize that using locums is sometimes the difference between having a service or not having a service available to our community. And so I think it's not, sometimes we get fixated on filling a schedule or, a gap in coverage and so forth. But I think we also need to realize that these locums are meeting a need, and oftentimes they're critical needs, and we should really respect and treat them and appreciate them for the service that they're providing. And I think it's really also important to give those locum physicians someone in the organization who is their contact. Just as we would with someone who is, joining our organization as an employee. I think that's really important. I think, again, not to repeat myself, but fostering those connections and integrating them into the organization is just extremely important.